afternoon, everyone. Thanks for joining us for this, our first COVID-19 press briefing of the week. Today, Orange County Mayor Jerry O. Demings will discuss our goals for the week, the opening of the Department of Health in Orange County's vaccination portal. He will deliver an appeal to Orange County's most vulnerable residents as it relates to transportation to the vaccination site as well. The mayor will give an update on COVID-19 testing and an alert on Orange County's eviction diversion program and other important information. Mayor Buddy Dyer could not be here with us today. However, from the Florida Department of Health here in Orange County, epidemiologist Alvina Chu is here to discuss testing, the variants, and other vaccination details. We begin with Mayor Demings. Mayor?
All right, good afternoon to all of you. Thank you, Dr. Williamson. This is our 109th press briefing since we started the coronavirus response and recovery efforts nearly a year ago. So today, I'm going to share good news, bad news, mostly good news. We'll start with my partner, Mayor Buddy Dyer, couldn't be here. Of course, you all know that Mayor Dyer got married over the weekend, so that is why he could not be here. I presume that he's on his honeymoon. So we'll start with the good news. And then we will go over the different goals for the week. The number one goal that we have each week is really to stop the spread of the virus within our community. Always number one. Number two is to continue offering free testing. Number three, continue offering vaccinations and work with the federal and state authorities to expand inventory. And the fourth goal this week is to offer rental assistance to avoid evictions. We will continue to focus on those efforts. And so this morning, the Department of Health in Orange County's portal opened up at 9 a.m. for appointments. And 45 minutes later, nearly 7,600, to be precise, appointments were booked, 45 minutes. So the demand certainly is significant here within our community. For those of you who didn't get an appointment, the portal will open again in the very near future. However, that we have not determined a specific date at this point. However, we do urge you to continue receiving alerts, and you can sign up to receive our alerts by going to ocfl.net //vaccine. There is also information on the federal pharmacy program on our website. To date, over 75,000 vaccinations have been given in Orange County at the Convention Center. And I'll talk a little bit now about the good news. In terms of testing, we want to remind our seniors that testing is still available at the Convention Center vaccination site. And if you want to get additional information about how to sign up for vaccinations, you can dial 311 if you have made an appointment and you want a ride to get to the Convention Center. We have made provisions to assist you with free rides through links. And you can, again, call 311 to get information about how to schedule those rides. Links needs at least 48 hours prior notice in order to schedule the free ride. To qualify, the senior must be able to prove they have a valid vaccination appointment. A family member or a caregiver may also ride along with the senior. Mask will be mandatory. The Links driver will stay with the rider the entire time, door to door. This, again, is for the Convention Center site only, the Convention Center site only. And more good news. As for the vaccination numbers in Orange County, 41% of Orange County residents aged 65 and older have received at least one COVID-19 vaccine shot, 41% of our senior population. As of this afternoon, that number is 99,898 individuals, or 6.7% of the population. 6.7% of Orange County's population. Since the start of the pandemic, there have been a reported 109,650 positive COVID-19 cases in Orange County. That's the bad news, 109,650 positive cases. 1,000 30 residents have died as a result of the coronavirus within our community. Bad news. Our 14-day rolling positivity rate is now 7.3%. That number has been declining. Good news. Just as a reminder, we will continue to offer the free testing at Barnett Park through the 28th of this month, and that testing is being made available 7 days a week. On with additional information. Orange County has provided more than $11.2 million in assistance and helped over 3,500 individuals and families stay in their home through our eviction diversion program. We are closing the program as we currently know it on Friday, February the 19th. That's this coming Friday at 6 p.m. We will close the existing eviction diversion program. But the good news, on March the 1st, we will launch our new Orange County Emergency Rental Assistance Program. The new emergency rental program has more than $33 million in federal funds to help with rent assistance for predominantly low-income and other qualified residents. You can find information about the COVID-19 eviction diversion program by going to our website, ocfl.net/eviction diversion. You can find information about the new emergency rental assistance program by going to our website at ocfl.net/emergency rental assistance. ocfl.net/emergency rental assistance. Okay. Let me just share some information on myths and facts. There's still a lot of misinformation floating around about COVID-19, and we want to make sure our residents know what is a fact and what is fiction concerning the vaccine. For example, one of the myths about COVID-19 is that once you get the shot, you don't have to wear a mask. That is false. To read about the facts versus the myths, you can visit our webpage at ocfl.net/vaccine myths. That information is also available in Spanish. And today we do have the ability to do the translation in Spanish. We have Commissioner Gomez Cordero, who has joined us. She's here to answer any of the tough questions. We already worked that out. We have Ms. Ilya Torres, one of my special assistants, to assist. We also have Mr. Scott Howard from the Orange County Public Schools has joined us today, should there be any questions for the school district. And with that, I'm going to turn it over now to Ms. Alvina Chu, the epidemiologist from the Florida Department of Health in Orange County.
Thank you, Mayor. Thank you. So as the Mayor had mentioned previously, we have had 109,650 positive cases. The recovery rate has gone up 1% to 96%. And unfortunately, we've had 15 deaths reported to us since the last time we spoke. To the families and friends, we send our heartfelt sympathies. 6 were female, 9 were male, and 9 had known underlying health conditions. 5 of the 15, or 33%, were reported with a long-term care facility residential address. I know you'd like to know about the variant cases, so since the last time we spoke, we've had 2 additional variant cases reported to us for a total of 12 cases identified in Orange County residents currently. The age ranges are from 18 to 61 years of age. The median age is 30. 7, or 58%, are males, and 5, or 42%, are females. Of the 12 cases, 9 were investigated and 6 interviewed. Of the interviewed, 1 reported out-of-country travel, and 5 reported no recent travel. 2 of the 12 cases are in persons who are in the same household or household related, so from a cluster. There are no reported deaths within the 12 variant cases and no reported hospitalizations among the 6 who were interviewed. There were a variety of symptoms such as diarrhea, headache, and fatigue, cough, olfactory disorder or loss of smell and taste, and also reported nausea and vomiting, fever, and congestion. 2 of the 6 interviewed cases reported experiencing no symptoms at all. So as we discussed last time about the variant cases, there might be some What we're looking for is mutations which might potentially alter the infectivity or the virulence or severity of the illness that might be caused by these variants, which is why it's crucially important that we continue during this time while we vaccinate people and build up community immunity, that we continue to practice our pandemic precautions such as wearing masks, watching our distance, and washing our hands. And this goes for until everyone is vaccinated and until we can identify and contain the variants. We've currently administered a total of 181,467 doses of COVID-19 vaccine. 160,545 were administered to residents of Orange County. That's 6.76% of Orange County residents who have received at least one dose of vaccine. Of the 65 and older group, we've administered 119,448 doses, and 100,060 of those have been administered to Orange County residents who are 65 and older. So that brings it up to 41% of Orange County residents 65 and older have received at least one dose of vaccine. As a reminder, our vaccination appointment system is currently for those who are 65 years of age and older. Those who are not 65 and older and have entered the wrong birth date to get an appointment will be turned away. Also, as a reminder, if you have an unwanted COVID-19 vaccination appointment to our event, please cancel it so that vaccine can go help protect another person. You could just log into our CDR Health Pro account at thepatientportal.com, fl.com, then click My Vaccinations, and then cancel from that screen. We just want to reiterate about the isolation guidance. So while there are still cases, it's important in order for us to be able to get a handle on the pandemic while we build up the herd immunity and the community immunity, that if you are sick, you stay home and you isolate for 10 days. If you have a positive test, even if you don't feel sick, you should stay home and isolate from 10 days from that test. And I also wanted to reiterate about our quarantine guidance. So this is to remove persons who've been exposed to a lab-confirmed case or a sick person, that you remain at home and quarantine. The best recommendation is 14 days from your date of last exposure to the sick person. We know that the virus is very contagious within a household, so we've seen lots of household clusters, many household clusters, essentially almost guaranteed. If you don't practice your good pandemic precautions while even at home, you could still transmit the virus to your family members. And so we want to reiterate about isolation. So currently, there were the options that CDC had provided. Still, the best recommendation, I'll say again, is 14 days of quarantine after your last exposure to the lab-confirmed person. But then also, we know that viral shedding decreases, and you might be able to leave quarantine at 10 days and continue to watch for symptoms in the last 4. And then there are also some test-based options. And those options can be found on the CDC's website for how to quarantine, when to quarantine and when to isolate. So with that, I'll end it and turn it back to the mayor, and I'll be happy to answer any questions.
Okay, we'll open it up for questions at this time. Questions, and we'll start this time with Ms. Lauren Seabrook.
Thanks, Mayor. Lauren Seabrook, Channel 9. Alvina, my question's for you. I'm curious, with the numbers being pretty low today in Orange County, I think under 200, does that change the way that your staff works at all with contact tracing from, when it was up near 1,000 a day? I know it was just almost too much to handle. Are you able to do more contact tracing now with it being so low?
So we're still working at the same, full capacity as we were previously, as we were in July. I know Dr. Pino has mentioned when we were at the peak July numbers that we weren't able to get to all the cases, and there's still this possibility that we may not be able to get to all the cases, but we are still working as best as we can to try to identify cases and conduct the contact tracing, which is why I wanted to bring up the isolation and quarantine guidance today, because anticipated your question a little bit. And so don't wait for us to call you. I think you all know what your personal responsibility is if you have a positive test and that you know you are COVID positive, that you should isolate for 10 days from the date of your positive test, or 10 days starting from the first day when you become sick, and as well your family members. So I mentioned that it's very contagious inside the same household because you're sharing the same living space. You have people get very comfortable around people that they live with, and wearing a mask inside your house is probably almost unheard of, or even social distancing inside of your house is difficult, especially if you have young children or people that you care for at home. But it is, so if you have a lab-confirmed positive case inside your household, your family members should quarantine at home, if without testing, for a minimum of 10 days. And the best recommendation is to stay home for 14 days to look out for symptoms so that you don't continue the cycle where you possibly go out, large gatherings or other events, and then spread it to other people. Thank you.
Troy Campbell with Channel 6. This is also for you, Alvina. With the 2 new cases of the variant, were those discovered through the random testing done by the state? And also, do you think the state needs to increase the amount of positive COVID tests for the variants?
So the 2 cases were identified through the random sampling. And so even in the pre-pandemic days, we still had, for virologic surveillance, random sampling. So there were, say, a good example is, say, the flu surveillance program, which is set up on 4 different pillars, one of which is virologic surveillance to look for different variants of the flu so that we can adjust our vaccine. So there is the CDC recommendations, which and a plan for virologic surveillance, which I think I mentioned last time I was here, last week. Sorry, the days run together a little bit. But the last time I was here, we talked about CDC recently setting up national virologic surveillance, which is also partnerships with state health, public health laboratories and also commercial laboratories to increase the amount of sampling that is conducted so that we can increase the number of positive samples that we can do genetic sequencing on to try to identify variants. And so I also wanted to bring up, it's not just the named variants that we have here, we're also looking for different mutations. So there are many different mutations. I mentioned last time that some of these mutations don't mean very much at all, and some of these mutations can give the virus an advantage, either spread more quickly or easily, or either produce more severe illness. And that's why, until we get a good immunity, we need to practice our pandemic precautions, because every new infection allows the virus to mutate and gives it this opportunity to gain some advantage.
Lara Greenberg, Fox 35. This question is for Mayor Demings. I'm just wondering how or whether the links free service to the convention center has begun yet, and if so, how many people have used it or applied to use it?
It has started, and the last numbers I have is about 20 people have availed themselves of the free ride by links. So we encourage others who may want to go to the convention center to get vaccinated to be able to call us through 311 or go to our website.
This is Melissa Thomas of Florida National News. This question can be for either Mayor Demings or Ms. Chu. In terms of, we recently spoke with Dr. Brady with the Advent Health vaccination site that was out closer by the airport. And one of the things he mentioned was, he had the capacity to perhaps vaccinate roughly 8,000 people a day or up to 50,000 per week. He said the biggest thing they're basically waiting on is more supply. So do either of you have an update in terms of the increase in supply? He said over this past weekend that I think it was Friday that we spoke with him, that was pretty much his last day at that site, only because they don't have any more supply, and the folks he was vaccinating were there getting their second vaccine, so he wasn't giving out any new doses.
What we have been told at this point is under the new federal program, hospitals and or community health centers will be getting direct allocations that will not be coming from the state's inventory. And so at this point, all we know is that there's some investigations going on now with potential sites in communities around America. We know that there's been an inquiry at the City of Orlando regarding a potential site in the city, one of their large facilities. And so that's still under investigation at this point. So as soon as we receive any confirmation about new sites or additional supply, then we certainly will share that with our community.
Buenas tardes, Félix Pirela de Telemundo. Una pregunta para la epidemióloga Albina Shu y también para el alcalde Demings. La primera sería... Okay. La primera tiene que ver con los casos de COVID-19 a nivel en todo el estado y también en particular el condado Orange, que han descendido en los últimos 14 días. Quisiéramos saber si ya, gracias a las jornadas de vacunación, estarían incidiendo la vacunación de la población, sobre todo mayor, de los adultos mayores, en lo que es el descenso de los casos acá en el condado Orange. Y la segunda pregunta sería, ¿se acaba...?
We're going to do the translation.
Okay.
We're going to go to the second question. The question is, COVID cases, or COVID-19 cases in our county have been decreasing lately, particularly within the 65-plus population. Do we attribute that decrease to the vaccination efforts?
We are optimistic that that is helping, yes.
Estamos optimistas de que ciertamente las jornadas de vacunas están ayudando al decreso de los casos.
La segunda pregunta sería para el alcalde. Se termina la jornada de vacunación este 28 de febrero. ¿Hay posibilidad de que se extienda la jornada de vacunación gratuitas?
¿Vacunación o testing?
Perdón, los testing sites. ¿Hay posibilidad de que se extienda las jornadas de pruebas gratuitas del COVID-19?
Sure thing. The question is, COVID-19 testings are set to end on February the 28th. Are there any possibilities of an extension?
The answer is yes. We're exploring the potential for expanding the testing, but we're really kind of waiting at this point on the final determination of local assistance from the federal government with the next stimulus round.
La respuesta es sí. Exploramos la posibilidad de poder extender la jornada de pruebas gratuitas de COVID-19, pero en estos momentos esperamos la decisión por asistencia de parte del gobierno federal.
This next question comes in from Asher Wildman for Scott Howitt with OCPS. His question reads, can you provide any insight or data into how students in face-to-face learning are doing compared to those on Launch Ed? How will the district handle students struggling this year in determining if they can advance to the next grade or not?
So we know that the students that are at home are not performing as well as those that are face-to-face, and we've sent letters out encouraging parents whose students are struggling academically or social-emotionally to send them back face-to-face. We've put more safety precautions in place for them. We're also working to increase tutoring opportunities for those students so they can catch up in some of their learning loss. That's been in place now and will continue to be in place through the remainder of the spring. We're also extending our summer school. So summer school will be twice as long as far as 2 months and twice as long during the day. So we're looking to really help all students who've experienced either learning loss because they were at home and not face-to-face, or those that are even face-to-face that are struggling as well. So we're going to do everything we can to invest our resources to make sure that we're taking care of their academic needs. Thank you.
And lastly, this question comes in from Ryan Lynch with the Orlando Business Journal for Alvina Chu. His question reads, what % of the over 65 population will have to be inoculated before appointments will be expanded? Is there a target percentage for that group?
I don't know that answer. I'm sure there must be before we move on to the next priority group, but the priorities will be set by the governor. Unless Mayor Demings, do you have insight?
A good answer. It's based upon the available inventory within the state, and the governor, as the inventory increases, I believe that within the next week to 2 weeks, we probably should see an expansion of the eligible individuals. Okay. All right. If there are no other questions, our next press briefing is scheduled for this coming Thursday at 4:30 p.m. Thank you all for joining us here today.